The following program is being brought to you on the Seventh Wave Network. For more information about our network and to check our additional show hosts and topics of interest, please visit seventhwavenetwork.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the following program are strictly those of the host or guests and do not necessarily reflect the views and ideas held by the Voice America Talk Radio Network, its staff, and management.
Welcome to Empowering Your Soul with Lisa Ouellet. If you're ready to make personal changes in your life and the lives of those around you, get ready for an hour of encouragement, enlightened guests, and engaging stories. Now, here is your host, Lisa Ouellet.
Hi, welcome to Empowering Your Soul. I'm your host, Lisa Ouellet. Today, I am going to be having with me as a guest, Heidi Botnick. She's a licensed acupuncturist. She's going to be here today talking with us about all different forms of what acupuncture can do for us and how it helps to heal. And that being said, I am going to introduce you to her now. So, Heidi, thank you for being my guest today.
Thank you for having me.
Great. So for people, can you tell us just a little bit about yourself? I know that you're a licensed acupuncturist and you are licensed in the states of New York and New Hampshire. Is that correct?
Yes, it is. Yes.
Okay. Go ahead.
I was just going to say I had a practice for about 7 years in New York, and I moved to New Hampshire a year ago, so hence the dual licensing, and I've been practicing, going on my 8th year now practicing in New Hampshire. So.
Excellent. So can you tell us maybe just a little bit about what acupuncture is for those of us out there? I've never had it myself, so I'm not exactly sure 100% sure what it is. Could you maybe just give us a little bit of a background about it?
Yeah, sure. So it's a healing modality that dates back over thousands of years from China. Chinese medicine, and it involves the use of tiny, sterile, hair-thin, pretty much, disposable needles that are placed on specific points on the body, and we're basically going into areas, determined by the practitioner, where energy is stuck in the body. And through the needles, we're prodding the body to help heal itself.
Great.
That's the short of it. So
now, I know a little bit, when I was doing a little bit of research on this, it has to do with meridians. Is that correct?
Yes. So, the theory is that there are meridians that run through our body. Mostly vertical. There are 14 main meridians, main ones, and other branching ones from there. Yes, the idea is that there's these meridians of energy that run through our body. And so when there's, pain, illness, dysfunction in one form or another, the idea behind that is that there's a block in our energy somewhere in the body.
Could stress do that? Sorry.
Sorry about that?
I was asking if stress could cause a block like that, too.
Absolutely. Stress is huge. And absolutely. So, once the practitioner determines through our different tools that we use, questioning and asking, and those are some of our tools. We take the pulse, we look at the tongue, we use palpation. We determine where the energy is blocked in the body. And that guides us to what points to use to help to unblock these areas. So, when there's an energy block, you could also think of it as, and the energy in Chinese medicine is, we call it qi,
right,
or ki in Japanese. So when that's blocked, if you can think of it this way, our blood isn't flowing as fast as it can, our lymph flow, things aren't functioning as optimally as they can. So when you get things open and unblocked, our body can then heal itself more easily.
That's great. And now, I have a couple of questions that I'd like to ask personally, and then maybe you could explain for that. But before I do that, I kind of want to know if you can tell us, how do you feel for yourself that acupuncture helps to empower the client, or the person receiving the actual treatment? Do you feel like how would you say that's empowering to others?
Sure. Well, I feel like just the nature of what acupuncture does by inserting these needles into the body, you're prodding the body to heal itself, and without any other interventions, meaning drugs or other chemicals. I mean, it's which is pretty amazing. Right. I mean, you're essentially, and that's exactly it. You're stimulating the body's own healing response, which, to me, that's pretty powerful.
Absolutely.
Yeah. And, and then in another way to look at that is, for example, say I'll be working with someone, they're, feeling much better, their pain is improved, and they'll take a break from treatments for a while, and I often get the question, when should I come back? And I often say to them, well, now that you know what it feels like to have your body in the better balance, when you start to feel things go off a little bit, not when they go really off, but when they start to, when you know what that feels like now, come in for treatment, come in for a tune-up.
Exactly. Let your body be the guide for when you need to come back.
Exactly. Because, and again, acupuncture is one of those things, in Western culture, our Western minds, we've been sort of taught to that mind and body are separate. And in Chinese medicine, that's not the case. It's, mind, body, spirit, it's all working together. So, and right. I think when you get acupuncture, you get a sense of what that feels like. And, I think in that sense too, it's a sense of empowerment, like what that feels like in terms of healing and knowing, getting an idea of when things may be out of balance, or start to go out of balance again. Yeah.
And so what you were just saying is people ask you how often they should come back. Now, I would imagine that the number of treatments really kind of depends on a lot of different factors, too. They could also depend on how long they've had their condition and how severe it is, or, I'm sure there's lots of different things for you to assess during the treatment. But would you say, I don't know if this is even something that you could answer, would you say that there's an average of 1 to 4 visits or, 5 to 10 visits? Is there generally, most things aren't cured usually or fixed within one treatment, I wouldn't guess, right?
Right. Yeah. That's very rare.
Right.
I've seen it a couple times, but it's rare. So yes, it does depend. And, yes, if something is long-standing and pretty severe, it's going to take a little longer to resolve. Also, it depends on lifestyle and what's going on there.
Sure.
Nutrition, sleep, stress. Stress is huge.
Right.
So, but when I see someone, I most of the time I'm suggesting, to give it at least 3 treatments, and that is a good. That's a good assessment if this modality is really going to work.
Yeah.
And,
that's fair.
But with that said, though, I have to say in my practice, usually people come back after the first or second treatment and experience either, some sort of change, some sort of relief in their symptoms, or something else is better, or, they sense a change. So, and that's great. But again, after if 3 treatments, there's just really not a whole lot of change, then I won't keep someone coming in.
Right.
So, yeah.
Well, that sounds, sounds like you assess it on each individual basis.
We do. Yeah. And, and from there, and people too, they also get a sense and feel like, okay, well, okay, let's give it a few more and then let's see where I'm at. Or, yep, let me do a ton of treatments, and it's also, again, going back to the empowering thing. They get a feel for it and say, okay,
I like that.
I wonder let me feel it out too, and let's discuss this. So
Heidi, do you do an initial treatment first before you see people? Do you have them come in for an initial evaluation and then suggest treatments at that point, or how does that work?
Well, no, the way I work, I'm happy to, discuss on the phone, do a consult over the phone to see if, acupuncture, may work, may help what they want to come in for. And, I'm happy to have that discussion, but usually, usually it's once they set up the initial appointment, it's coming in and we do, they'll fill out paperwork. We'll do a full intake, which means a lot of question and answering and health history and all of that. And, and then we'll usually, I'll do an assessment, with, taking the pulse, look at the tongue, I'll do some palpation, and then we'll do a treatment.
How long does a normal session or the average session with you normally take? What is that
initial session, depending on what's going on with someone, it can take up to an hour and a half. I try to keep it to an hour, but again, I always block that time up to an hour and a half.
Okay.
So it just depends. And then follow up, again, depending on what's going on, anywhere from 45 minutes to an hour. And that includes everything, sitting down, discussing, how their week was, what's happening since the last treatment, doing the treatment and out the door. So,
right.
I tend to take up the full hour, but it really, it just depends. So.
Well, that sounds like an average. Yeah, that sounds like pretty much most healing modalities as well, too.
Right.
Let me ask you this, Heidi. Because this is something that you're doing one-on-one, I wouldn't imagine that this is something that you could do over the phone. Is that correct? This has to be a one-on-one, hands-on. Is that correct?
Yes.
Okay.
Yes, because I am, we are inserting the needles into points on the body. Yes.
So for people locally in the New England area that would like to get in touch with you, how would they be able to, what would be the best way for them to get in touch with you? To just go to your website?
Yep, my website, either through, there's all my contact information there. I have people email me, call the first time, whatever they're comfortable with.
And what is your website?
My website is, right now, it's changed over. It's temporary, but it's HeidiBotnickAcupuncture.com.
Perfect. So if people are in the New England area and would like to get in touch with you, now you have 2 practices in New Hampshire. You have one in Bedford, New Hampshire, and one in Moultonborough. Is that correct?
Yep, I split my time right now. So I'm down in Bedford on Mondays and Tuesdays, and I'm up in the Lakes region in Moultonborough. I practice out of Holland Hill Studio there Wednesdays, Thursdays, and Fridays. And in Bedford, I'm at Bedford Body Care. So I share the office with a massage therapist here. So
perfect. Yeah, and that's how I met you through
Bedford
Body Care.
That's Kimon,
And now, before we go to a commercial break, I wanted to ask you too: are you still have clients from your New York practice, or are you, obviously they're in New York? You obviously can't be in touch with them, I would imagine, unless you're out there in that area. But have you noticed a difference in clients from one state to the next? Does that have, do they have different ailments, or is everything kind of the same? I know we'll talk more about different treatments in the next segment, but have you noticed a difference?
Interesting. Yes and no. I thought perhaps, I was seeing a lot of high-strung, really stressed-out people in New York.
Well, from Manhattan and Brooklyn, I would imagine.
Yeah. So, actually, I think, I'd say that was actually a large part of my practice. Certainly not all of it, and I wouldn't say that for, but that was a part of it. And I thought, well, maybe there'll be less stress-related conditions up here, but Not necessarily so.
Yeah, we have a lot of stress in New Hampshire, apparently, in the New England area.
And, a naturopath said it really well, who practices out of Concord. She's wonderful, and she calls it our modern, 21st century syndrome, which is just like this, everyone, there is a big stress component. I mean, we're going. I think all the technology, everyone's, just going a mile a minute and trying to multitask so much. And that's not just in the big cities, it's everywhere. And, people just,
we all want to do too much too soon. We want to push ourselves past our limit, get everything we can get in one day done. There's only 24 hours in the day, and I think sometimes we don't realize that. We think we can squeeze 26 hours into one 24-hour day and not sleep at all.
And it's funny, I think, we've sort of gotten used to that. And then, and again, the quick responses, either text, email, everyone's accessible, so we have to go and respond and keep going. And
there's no waiting period anymore, right?
No, and I think, and that's just one factor, but I think there's multiple factors going on, our food and everything else that cause, we end up in a stressed out kind of state, and the effect that can eventually have on our health. So if it's not, if we don't, try to find tools to manage it as best we can, because there's always going to be stress.
So basically, you're saying New York and New Hampshire, a lot of stress in both. We're gonna stop here for a quick. Is that what you were saying? We're gonna stop for a quick commercial break, but pretty much the same in both states, right?
Yeah. Okay. I mean, slightly different maybe, but it's there for sure. So
okay. Well, we'll talk more about that when we come back. We're gonna actually just take a break here, and I want you to pay attention to, if you have an iPad or an iPhone, or if you haven't had a chance to go and listen to the show live, just feel free. You can download the Voice America app or the Stitcher app, and you can listen at any opportunity at your leisure. You can go directly to my website, lisawillette.com, and you can listen there. And we're going to go to commercial, and we'll be back right in a moment.
Your favorite Voice America Talk Radio Network shows and hosts are in your car, outdoors, and wherever you need them to be. Listen anywhere. Get our mobile app for iPhone, BlackBerry, or Android at the Apple iTunes App Store, BlackBerry App World, or Android Market.
Lisa Ouellet is honored to assist you as you move forward from imprisonment to empowerment. Individual intuitive sessions are available in person, by telephone, or via Skype. Visit www.lisawillette.com. While there, you can also find information about 1 hour and half-hour Reiki sessions, life coaching, and tuning into your intuition classes. These classes will help you learn to trust your intuition and tune into yourself more easily. Mention that you heard about us on Empowering Your Soul and receive 10% off your next session. Visit lisawillette.com today.
Have you friended us on Facebook yet? Why not? Just go to facebook.com/Voice America or search for the keywords Voice America. Once you are part of our Facebook network, you'll receive daily messages about what's happening with our shows, this week's featured guests, and new happenings of the Voice America Talk Radio Network. And you can add your voice to the always active discussions on our wall. Just go to facebook.com/Voice America or search for Voice America.
These days, everyone is looking for information on staying young, healthy, and fit. The Voice America Health and Wellness Network is here to help you on your quest to better health and a better you. We talk about everything from diet, fitness, and aging to substance abuse, personal growth, mental health, and much more. Learn from our experts who cover health and wellness from traditional and holistic perspectives. Tune in to the Voice America Health and Wellness Network. Healthy living starts here.
Think you've seen everything there is to see in online television? Let us surprise you. Visit voiceamerica.tv today for sports, health, business, and more on demand 24/7.
You You are listening to Empowering Your Soul. To reach Lisa Ouellet, you may send an email to lisawillette@comcast.net. That's lisawillette@comcast.net. Now, back to Empowering Your Soul.
Thank you for coming back to listening to Empowering Your Soul. I'm your host, Lisa Ouellet. If you're just tuning in now, today I have with me as my guest, licensed acupuncturist Heidi Botnick. We were talking before the break about a little bit about what she does and how it empowers others. And we were talking about the differences between the states. And apparently there's stress in both states. So it doesn't matter where you live. You can use acupuncture in whatever state you're in. So that's good to know. We are going to, so welcome back, Heidi. Thank you for being on the show today. And I wanted to ask you, I had a couple of questions myself. Again, since I've never had acupuncture, I don't really know. I guess one of the things that I'd like to know is, do the needles hurt? Because that's one of the things I've always wondered about, I know they're probably small, but do they hurt?
It's I want to say they don't hurt. But, I hesitated on the answer because everyone has, such different sensitivity levels.
Sure.
So, we in this country, most of us use guide tubes. So what that means is the needles come prepackaged in these guide tubes. And also, when we go to do a point, we're really compressing in the skin with our hand and a guide tube, and then we tap the needle in. So that, the guide tubes also, they help with the sterility, but it also helps to, I want to say, like, deflect from, feeling the needle go in. And I have to say, most people, don't feel it at all. I mean, and good. If anything, it's like the teeniest little pinch. And then once the needle's in, you depending on the point, depending on the technique and the manipulation of the needle by the practitioner, certain points feel achy or tingly, or you can feel like a heavy or numbing sensation.
Do they stay in for the whole entire time? I mean, for the whole session, do they stay in the same spot?
Yes, they do. Yep. Okay. So usually we'll do, I'll do a treatment, put all the needles in, and then, let the patient rest anywhere from 10 to 20 minutes, depending on the time, depending on, how much, I had to do with the needles and usually that time most people do find pretty relaxing, and some people just go right to sleep.
I was going to ask you if people fall asleep during that. That's interesting.
They do, yeah, which is great. It really settles that nervous system down. So, but going back to that, I do get a lot of people that I want to try it, but I'm terrified of needles, or I know I need to do this treatment, but that is fine. I've worked with so many people that have a huge fear of needles, and I try to explain everything really thoroughly, and we'll just start with one or two points, and they'll say, "Oh, that's it," and then we proceed from there. And I've never had a problem. Again, I've had people that are really, needle phobic. Needle sensitive.
So, you also do something different. Could you elaborate a little bit more? You do something called trigger point dry needling. Is that something different?
It's not different. It's acupuncture. It's different in that it's a special technique that I was trained in. And it's great for all types of musculoskeletal, orthopedic pain. I treat a lot of sports injuries. It's extremely effective. And basically what it is trigger points, by definition, are areas of focal constriction, the muscle, the tissue, even the fascia, and they can even be in tendons and ligaments. It's areas that create local and or referred pain. So you could have a trigger point in your shoulder. So say someone comes in with pain down the arm,
Yep.
that can be from a trigger point in the shoulder, so far from where they feel the pain. That's just an example.
That's interesting, because I was going to ask you, I tend to carry a really heavy purse. People say, oh, she's got her suitcase with her. And I sometimes have arm issues, and I'm wondering, is that caused from a different point of origin, or could that be caused from a different point of origin? And would acupuncture help with something like that?
Oh, sure. That's something I see all the time, and yes, and we often forget. I've Western practitioners have spoken to them about this too. That it's our areas of pain are often coming from somewhere else. Another dysfunction in the body, or for example, trigger points. So. With this technique, basically, I'm going, in with the acupuncture needle into the trigger point, and you're releasing it. What the patient feels, you basically feel little twitches in the muscle. You're feeling that release. So that's essentially what that is. And I do use it quite often. Again, I go per patient, depending on, people's sensitivity levels, but it's extremely effective. And it's a wonderful, I'm very glad that I was trained in it, because it's an amazing technique.
You were trained at Tri-State College of Acupuncture, is that correct?
Yep, that's down in Manhattan. Yep, that's where I went to.
And you got a master's degree there in acupuncture, right? And you also have a degree in Chinese herbal medicine, if I understand correctly, right?
Yep. So
so you incorporate both into your practice.
I do. Yep.
Nice.
I do.
And you do something different. I shouldn't say different. I know that you personally, you integrate your Chinese medicine with your herbal, using the herbs. I believe you're into herbal remedies, and with your nutrition. How does that all tie together into your practice? How do you find using all of those together work, especially with energetic medicine too? You kind of all encompassed.
Well, the Chinese are, I do use, I love them. I suggest them, where, as I believe necessary, or, where I think they'll be really effective. I don't use them for every patient. I don't. It just, again,
as needed basis.
It's case by case. Yep. Again, I've had some people come in that just really they definitely want to do herbs, and that's great. We'll do that too. And then, in addition to that, I've just in the past year or two, I've just been looking at some other sort of homeopathic or Western remedies. That's something I'm kind of playing with right now. Also, essential oils. So they're just more tools under my belt. And again, the herbs and any sort of herbs right now. I'm always reading about them, and also nutrition, and that is also a big passion of mine. And I think it's becoming ever more important with our changing food supply, and also its effect on our health, and again, going back to stressors, not eating correctly, that's, or eating the wrong foods, what kind of stress that actually puts on our body too.
So not eating the right kind of foods can actually cause you to go into a stress mode?
Sure. Yep. For example, too much sugar, absolutely. That can stress our adrenals, just in our blood sugar levels, and going up and down. So, sure. Inflammation in the body. Inflammation is huge, and there's a lot of talk about that right now. And it's real. I mean, it's not just talk. It's real, and it's happening, and we're seeing the effects in people's bodies and their health. And we're seeing it. I know naturopaths, other healers are seeing it too. And so anyway, I with that, I go back to, nutrition is a big leg of that sort of circle, if you want to say, of what affects us.
You treat people for, I know that you have an extensive experience treating such a wide range of conditions that people come to you. I mean, I know you talked earlier in the show, you were talking about you treat a lot of people, sports injuries, orthopedic, things like that. But you also treat people for headaches and digestive issues, gynecological problems, like menopause and depression, anxiety. So you treat it all, right? Have you seen, is there a common type of issue? Like, would you say 8 out of 10 people or, 10% of the population have like a particular, I know that's kind of generalized, but I just was wondering if that's something that a lot of us are experiencing the same.
Yeah, that's interesting, actually. I laugh because I've spoken to a couple clients recently about this, and that just to divert as a second, I find it really interesting because I'll have a lot of sciatica walking through my door, low back sciatica, and then I won't see any cases of it for a couple months, and then I'll see a lot of shoulder pain, and then I'll see a lot of knee pain. It's interesting, and I don't know what that is energetically in the bigger picture, but I think
we attract, we were talking in one of my previous shows, I know because I do psychic work here and intuitive readings and things, and a lot of times I'll attract clients to me that I'm on the same energetic level with, so I'll all of a sudden, I'll get like 6 or 7 clients in a row that have, job concerns or money concerns or family problems or, whatever.
Okay, yeah,
and that's kind of what I might be going through at that time. And I feel like maybe we as healers or practitioners put that out there. So do you find that maybe you're getting people that, are you having back pain when you're getting those kind of people,
That's a good question. I haven't thought about that, actually.
Like attracts like.
Although that would make sense in the past year, because I've been battling a shoulder, and I've seen in the past year and a half a lot of shoulder pain, so it could be, who knows.
See, you have to pay attention to that, make it a point to take notes.
But in general, though, I'd say a lot of what's coming through my door, aside from, the pain conditions, or, musculoskeletal, headaches and migraines are a big one. That acupuncture actually in the past was the only thing that cured mine. And digestive, again, going back to our food and what it's doing, a lot of not even vague, but, very troubling digestive issues. Again, acupuncture and herbs have been very helpful. Insomnia, allergies right now.
Oh, that's so funny. I was just going to ask you. I'm like, allergy season is kicking my butt. Is that something that you could treat people for allergies?
Very helpful. Yep. Acupuncture has been great.
Now, is that done on the face then, or what? Where would that be?
Some points. Yep. And again, it depends where we find the imbalances, but points will be done all over the body, but, certainly if there's a lot of facial, head congestion, head, chest, I will be doing some points on the face and the head, and, they're so effective. They're just amazing. So it really just gets things opened up.
That's exactly what I was just going to ask you. I was thinking to myself, whoa, this allergy season has been awful, and I'm trying really hard not to use any over-the-counter medication for it. I'm trying lots of different, I'm open to different avenues and I think a lot of people out there don't want to go the route of chemicals, and they don't want to use Claritin or Benadryl or whatever. And so that's good to know if you're out there and you're local and you're having allergy issues, this is something that you might be able to look into. And what is an allergy? Could that be treated in maybe 4 visits or less, or?
Oh, yeah.
Is that a generalized statement?
Yeah, definitely. And again, it really varies. I mean, I have someone recently, she has really bad allergies all year long, and even after one treatment, again, this doesn't happen all the time, but after one treatment, she was feeling so much better. They're not cured, but they're a lot better. And so it depends, and I've had cases in the past where, it took, probably 3 to 5 or more treatments.
But that's still not bad in the long run when you're thinking you have to take medication, otherwise every single day, all during the spring and all during the fall, every year, year after year. So 3 to 5 visits really in the long run that's not a bad thing at all.
It's not so bad, right? Yeah, but it's very helpful. So, and the other category, really so helpful is all types of gynecological disorders, hormonal imbalances. PMS, infertility is a big one. I saw a lot of that in New York. Menopausal symptoms. So acupuncture is just really, really helpful in those areas too. And again, something that a lot of us see walking through our door, Chinese medicine practitioners. So,
excuse me. That's perfect. Those are really good things to keep in mind. And, I'm going to look into that myself too, because I never tried it. I've never experienced it. And that's something I think that I'm definitely going to look into. We're going to stop here for just a quick break here. I want to, when we come back, I had asked people, if anybody's interested in having a question answered during a show, feel free to email me at lisawillett@comcast.net. I had put that out prior. I put that out each week, and people know what show's coming up from looking on the website. And we do have a question from Olivia in Berwick, Maine. We'll answer her question as soon as we come back from the break. So stay tuned. We'll be right back.
Your favorite Voice America Talk Radio Network shows and hosts are in your car, outdoors, and wherever you need them to be. Listen anywhere. Get our mobile app for iPhone, BlackBerry, or Android at the Apple iTunes App Store, BlackBerry App World, or Android Market.
Lisa Ouellet is honored to assist you as you move forward from imprisonment to empowerment. Individual intuitive sessions are available in person, by telephone, or via Skype. Visit www.lisawillett.com. While there, you can also find information about 1-hour and half-hour Reiki sessions, life coaching, and tuning into your intuition classes. These classes will help you learn to trust your intuition and tune into yourself more easily. Mention that you heard about us on Empowering Your Soul and receive 10% off your next session. Visit lisawillett.com today.
Have you friended us on Facebook yet? Why not? Just go to facebook.com/Voice America or search for the keywords Voice America. Once you are part of our Facebook network, you'll receive daily messages about what's happening with our shows, this week's featured guests, and new happenings of the Voice America Talk Radio Network. And you can add your voice to the always active discussions on our wall. Just go to facebook.com/Voice America or search for Voice America.
These days, everyone is looking for information on staying young, healthy, and fit. The Voice America Health and Wellness Network is here to help you on your quest to better health and a better you. We talk about everything from diet, fitness, and aging to substance abuse, personal growth, mental health, and much more. Learn from our experts who cover health and wellness from traditional and holistic perspectives. Tune in to the Voice America Health and Wellness Network. Healthy living starts here.
Think you've seen everything there is to see in online television? Let us surprise you. Visit voiceamerica.tv today for sports, health, business, and more on demand 24/7.
You are listening to Empowering Your Soul. To reach Lisa Ouellet, you may send an email to lisawillett@comcast.net. That's lisawillett@comcast.net. Now, back to Empowering Your Soul.
Thank you for tuning in again to Empowering Your Soul. I'm Lisa Ouellet, and today we're talking with Heidi Botnick. She's a licensed acupuncturist. We're talking about acupuncture, and I'm learning all kinds of new things that I did not know about acupuncture. Right before the commercial break, we got a question in from Olivia in Berwick, Maine. She writes in, Is it safe to use or to have acupuncture during pregnancy? So that's a great question, Olivia.
Yeah.
Heidi, can you answer that?
Yes, it is. I've treated, in my previous practice in New York, I definitely treated pregnant women. Many of us do. It's great. It's great for, if, I've treated back pain, hip pain, nausea, anxiety. Those seem to be the big ones. I've treated some other, more obscure things too during pregnancy, but it's very helpful.
So it doesn't interfere at all with, with the hormones or anything like that, and it's safe it's not anything that's going to affect the fetus or anything like that?
No, it's absolutely safe. I mean, just to be sure that you're, vetting the practitioners properly, obviously that they're licensed, and,
sure.
I think most people, realize to do that these days. So, just to be sure. And, you could certainly ask, do you and have you worked with pregnant women? I know for me, a lot of the women I treated, I had been working with either to get pregnant or I had already worked with them before getting pregnant, but not always. As a practitioner, like if someone's had, you certainly want to know if someone's had difficulty, with getting pregnant, with the pregnancy,
Right.
So there are some, again, per practitioner, as to, how you want to treat and
okay.
In terms of, you sort out those issues, when someone comes for treatment. So
okay, perfect. Well, thank you.
Yeah.
Thank you, Olivia, for writing in and asking that question. I hope that you'll be a longtime listener and keep listening to the show. Thank you so much.
But it is safe and wonderful. So
good. Well, that's good to know.
So,
I know a few people in my life that I will pass that information along to, whether they know it or not. So they're going to be getting that.
And one last thing there. It can also help with delivery as well. So
oh, really?
If it's wonderful. If someone's really late, and acupuncture can, or if to turn the fetus as well. If the fetus is breached, if you can get get to someone in enough weeks ahead to help turn the fetus. Yes, it's amazing.
Perfect.
So,
well, I definitely know some people I'm going to pass that information along to. Then that's great. I didn't realize that. Yeah. What about, and then I'm just curious, what about, I know you were talking a little bit about, you were talking about gynecological problems, menopause, things like that. So you work with a lot of females for different things like that. What about for and this isn't a male or female thing, but what about smoking or stopping smoking or somebody that has a substance abuse problem? Is that something that could be stopped? If somebody wanted to empower themselves and stop a bad habit, is that something that they could use acupuncture for?
Sure. Acupuncture is very helpful in those areas. I get most of the calls, obviously, for smoking and weight loss, and smoking.
Oh, that's a great one. Yeah.
Yeah. So so for smoking, for example, yes, it's helpful, but I'm very clear with people on the phone because you'll hear these miracle stories. Oh, smoking, their acupuncture cured my smoking. So I'm always very clear. You really have to be ready. You gotta want to do it. I mean, throw all the cigarettes out, clean your clothes, clean the house, be ready to do it. It's not a cure-all, but it's amazing at helping the cravings, helping the symptoms of withdrawal and detoxing and, anxiety-related symptoms, sleep, the agitation that can go along with it. Herbs can be helpful too. So again, it can really help tremendously, but I just want to be clear with people. It's not
it's not the miracle. Right.
Take care of it, yeah. So,
but it's good. It's good to know that it's not just for pain relief specifically. You could use it for weight loss. You could use it to stop a bad habit. Those are good things to know. If you didn't, I didn't know. I learned something new today. I didn't know this. So it's
and right, it's mostly gotten most people think, oh, pain relief. And in fact, yes, it's effective for so many different things. And, pain is one of them, and it's wonderful at relieving pain. But there are, many other things that acupuncture is helpful for.
What about side effects? Is it safe? Like, I'm sure it's safe or you wouldn't be doing it, but are there any side effects that you can get with having acupuncture?
Well,
or are there probably few, right? They're probably very rare. They probably don't happen often.
Yeah, no, there really, honestly, there really aren't any. I mean, sometimes you can get like minor bruising from points, and again, if a point, and again, if it may just bleed a little bit. If it does, I always tell someone, and I say you may bruise here, you may not. So that can happen.
Is it like giving blood? Like sometimes when I give blood, I get a little lightheaded after. Would you feel maybe lightheaded after having the needle in you, or?
Some people do. Again, I don't see it that often.
Okay.
Some people do, but if you do, it usually subsides pretty quickly after. Some people just need to sit for a minute, have some water. That'll help ground the energy, and, they're okay. But I don't, I've seen it a handful of times. It does happen, but it's not so often. And, it's mostly too if someone comes in for a morning appointment and they haven't had anything to eat. So I try to catch people if they're coming in for their first appointment in the morning, please eat a little something. So again, that can leave people lightheaded, so.
All right. Well, so just kind of to recap a little bit, acupuncture is used for pain management. So for all different parts of the body, head, back, knee, elbows, heads, knees, shoulders, toes. What's that song? Gastrointestinal, right? So it can be used for like reflux, anything that related, gynecological, anything. You just talked about, the question was pregnancy, infertility, getting pregnant. It's used for respiratory, right? We talked about allergies and asthma. And what about the common cold? Can it be used to?
Even, persistent cough, cold and flu, like when, if you're right when that window you feel like you're coming down with something, you could come in for a treatment. Also some herbs, it's very helpful. Or that persistent cough that won't quite go away, coming in for treatment can really, really help push it along. So,
excellent. Excellent. So asthma, bronchitis, common cold, sinusitis. We just talked about smoking, to stop smoking, to maybe stop for helpful with weight loss. You talked about anxiety and stress. And what about something like if somebody had I just felt like I was having vertigo the other day. What about vertigo? Would something like that?
It is helpful. Yes, it's helpful. I've seen a few cases of that, in fact. So it's pretty helpful.
Excellent.
Yeah.
And what should people eat before they come for treatment? Like what's normally to be expected? Like do you have to have, like, again, I'm relating it to giving blood because that's the only other thing usually that I ever have needles put in me. But usually, sometimes they say come on an empty stomach. Some say come, eat a breakfast before. Should you eat afterwards? What's the procedure?
Usually I basically just don't want anyone coming in starving. Like if they show up at noon and haven't eaten all day, not so good. But that doesn't mean to have a heavy meal, just something in your stomach, something in your system, so that you're not, also not on a full belly or, too empty, somewhere in between. And, I try to keep something here in the office, too, in case that happens. Just to even have a handful of nuts would be fine. Just some protein in the body. So, and then afterwards, too, it also people do feel spacey or, a little, spacey or dizzy that way. I usually say, too, have water usually helps. But if
so stay hydrated or continue to hydrate throughout the remainder of the evening or the remainder of the day.
Good. But even just having like a little snack, or if it's evening, go have a nice healthy dinner and just take it easy. So it's usually good.
Perfect. That's great. These are things I did not know. So I feel like I've learned a lot today.
Oh, good. That's good.
Yeah. Well, I did want to ask you one more thing too. When earlier you were talking about what were you saying? You were talking about the meridians. Now, if people aren't familiar with the meridians, does it matter? Like, you don't have to have like a working knowledge of your body, right? You can just kind of come in and.
Yeah, not at all. I certainly welcome any questions. Some people want to know a lot and they have a lot of questions and, everything about acupuncture, and that's great. Other people, are just like, okay, do what you need to do. And I'm open to it, and I don't need to know a whole lot more.
So acupuncture is for it's for the everyday person next door, as in addition to the spiritually enlightened person who knows all about meridians and all the energy flowing through their body. You can be that person, or you can be the person that has no clue. I know nothing about it, but it's something that I've always wanted to try. Okay.
Oh, absolutely. Yeah. Definitely. So, and in fact, acupuncture is used a lot on dogs and horses and even cats, which is pretty amazing. Oh. And I can tell you, they probably don't know anything. I mean, except intuitively,
Well, right. I didn't realize that could be done on. Wow, I didn't realize that.
Yeah, it's pretty amazing. You have to be a vet. In fact, I'm pretty sure most states see that. So it's something I wanted to do, but I'm not going to go back to vet school. So, but yes, and that's, it's pretty amazing. Animals respond really well to acupuncture. So that's
because they have no preconceived notion about where their blockages would be, right?
Well, and one of our professors would say in school in our training that, if anyone doesn't believe it, tell them to look at horses. And he was right. I mean, because what do they know? I mean, and dogs too. So, they respond really well to the treatment. So it's funny. It's interesting. Wow.
That's very interesting. This is, again, this was a very eye-opening show for me. I didn't realize first of all, I didn't realize that it doesn't hurt, which is great. That's the number one thing that would make me decide one way or the other. As long as the needles don't hurt, I'm good. Even if I have a low pain tolerance, I can take a little bit of a pinprick. That's fine. It works on animals. We talked about all the different conditions that it covers: respiratory, physical, sports oriented. There's just so many different it's just something that I definitely am going to try, and it doesn't sound like it has many side effects either. So this is great. If you're in the area in Moulton Borough or in the New Hampshire area or New England, and you don't mind traveling a little ways here, Heidi can be reached again at right now, it's www.heidibotnickacupuncture.com. You can schedule a session with her. I'd feel free to call me or email me as well. I am at lisawillette.com. And I want to thank you for Heidi for being on the show this week and for giving us such informative information about acupuncture. I definitely feel like I learned something that I didn't know before. So.
Oh, good. Well, thank you for having me. I hope it was helpful.
Yeah, no, it was extremely. And I want to ask everybody to, again, if you have any questions, please feel free to email them. If you have any questions about today's show, you can email them to me and I'll forward them along to Heidi, or you can reach her directly if you do have any questions. I would love to have feedback from anybody who has anything, about any of the shows. Email me anytime. I'd love to hear from you. Next week, I'm going to have with me as my guest, Sonia Fitzpatrick. She is an animal communicator. We're going to delve into the topic of animal communication. So please come back next week and listen in. And again, thank you, Heidi, for being my guest today. Have a great weekend, everybody.
Thank you for listening to Empowering Your Soul. Please be sure to join Lisa Ouellet for another engaging program next Friday at 9 a.m. Pacific Time, noon Eastern Time on the Voice America 7th Wave channel. This week, stop feeling imprisoned and start being empowered.
Thanks again for listening to the preceding program brought to you on the 7th Wave Network. For more information about our network and to check out additional show hosts and topics of interest, please visit seventhwavenetwork.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the preceding program are strictly those of the host or guests and do not necessarily reflect the views and ideas held by the Voice America Talk Radio Network, its staff, and management.